Good morning, friends. I am Dr. B. Varun Rao, consultant medical gastroenterologist and liver specialist at Nitya Gastro Liver and Clinic, Chandanagar, Hyderabad. Friends, March is a colonic cancer awareness month. Colon cancer or cancer of the large intestine is the fourth most common cancer in India, both in men and women, but with very high mortality rate. Means a high amount of death rate with patients who are diagnosed with colonic cancer. And the main reason is delay in diagnosis. If we speak about the risk factors of colonic cancer, people who are having an age of more than 50 years, who are having a family history of colonic cancers, who are obese, who are having habits like alcohol consumption or smoking on a regular basis, who are increasingly consuming processed meats and red meats on a regular basis, these kind of people, they are at increased risk of colonic cancers. So screening is done in particular category of patients who are at increased risk of colonic cancers. As I mentioned, the risk factors: increased consumption of alcohols or smoking on a regular basis, increased consumption of processed meat or red meat, or any family history or genetic predisposition, or prior history of inflammatory bowel disease. These kind of patients, they should get screened for colonic cancer by doing a procedure called colonoscopy. In colonoscopy, we insert a flexible tube with an infrared camera into your large intestine to look for any abnormal growths, polyps, cancers, and take biopsy for confirming the diagnosis. Coming to symptoms of colonic cancer, any patient who is having long standing abdominal pain, especially crampy in nature, any patient who is having diarrhea or constipation, either alternating way for more than 6 weeks, not responding to routine medications, any patient who passes blood in the stools or passes black colored stools, who is having loss of appetite, who is having unexplained weight loss, or any patient who is having fatigue or low hemoglobin, these kind of patients should get investigated by doing a colonoscopy and rule out colonic cancer. One common thing often we see in the practice is patients who are having bleeding PR, they go to some primary care provider, they get the surgery done for piles, and after that they land up with us with advanced stage of colorectal cancer. So often we suggest that before going for any kind of surgery for piles, fissures or fistulas, always do a colonoscopy to rule out any other associated problem with it. Coming to prevention, there is no definitive strategy which will help in preventing colorectal cancer, but yes, some precautions definitely you can take which can help us in decreasing the incidence and picking up the disease early. Any patient who is above 45 years should undergo a screening colonoscopy to look for any polyps which predispose to colonic cancer in the future. Try to maintain an ideal body weight. Do exercise regularly, at least 30 to 45 minutes every day to maintain the ideal body weight. Decrease consumption of processed food, processed meat, and red meat because this predisposes for colonic cancer. At the same time, avoid intake of alcohol and smoking, which are known risk factors for colonic cancer. Previously, colonic cancers was more commonly found in the age group of above 50 years, but nowadays we are seeing colonic cancers and rectal cancers being diagnosed in the young population, even the third decade, fourth decade of life. In last 2 decades, there is an increased incidence of colonic cancer in India due to various factors: changing demographics, rapid urbanization, increased consumption of processed food, and diet and lifestyle. Colonic cancer, if detected early, not only saves lives but also decreases the physical and mental suffering arising out of the disease. It also decreases the financial burden on the family. Colon cancer is treatable and beatable only if it is detected early. Thank you.